What if I told you that the pill you take every single day, the one your doctor prescribed years ago, and you've been faithfully swallowing ever since, could be the very thing slowly weakening your heart? I'm Dr. Michael Turner, a cardiac surgeon, and over the past 2 decades, I've operated on thousands of hearts. But one of the most heartbreaking patterns I've seen isn't caused by what people eat or how much they exercise. It's caused by something they trust completely: their medication. Today, I'm going to break my silence about a class of drugs so commonly prescribed, so widely accepted, that questioning them almost feels like heresy. But the evidence is undeniable, and the stakes for people over 60 are too high to stay quiet. Stay with me, because what you're about to learn could literally save your life or the life of someone you love. Welcome. Thank you for being here and for caring enough about your health to seek out real information. As a heart surgeon, my job isn't just to repair damage after it's done. My true mission is to prevent that damage from happening in the first place. And believe me, one of the hardest conversations I have is with patients and their families when I have to explain that the very medication meant to help them has instead contributed to their heart's decline. Let me paint you a picture of what a healthy heart looks like. Your heart is an incredible pump, a tireless worker that beats roughly 100,000 times every single day without you even thinking about it. It's a muscle, the most important muscle in your body, and like any muscle, it needs fuel, oxygen, and the right conditions to perform. It has 4 chambers that work in perfect harmony, valves that open and close with precision, and an electrical system more sophisticated than any pacemaker we can build. When everything works as it should, blood flows efficiently, your organs get what they need, and you feel energetic and alive. But as we age, the rules change. By the time you reach 60, your heart has been beating for over 2 billion times. The walls of the heart can become stiffer. The valves might not close as tightly. The electrical system can become more sensitive. This doesn't mean your heart is broken. It just means it needs more careful support. And that's where the problem begins. Because many of the medications we prescribe, while effective for younger people, can become dangerous for aging heart. Now, before I reveal which medication I'm talking about, I need to share a story. It's about a patient I'll call George. He was 68 years old when I first met him, a retired teacher, a grandfather of 5, a man who followed every doctor's order to the letter. George had arthritis in his knees from years of standing in front of classrooms. The pain was constant and robbed him of his morning walks, something he loved. His primary doctor prescribed him a common anti-inflammatory medication, an NSAID, specifically a high dose of ibuprofen, to take twice daily. George took it faithfully for 2 years. Then one day, George woke up feeling like he was drowning. He couldn't catch his breath. His ankles were swollen to twice their normal size. His wife rushed him to the emergency room, terrified. When we examined him, the diagnosis was clear: acute decompensated heart failure. His heart, which had been working fine before, was now so weak it could barely pump blood. Fluid had backed up into his lungs and legs. George looked at me with fear in his eyes and asked the question that haunts me: "Doctor, how did this happen? I've been so careful." The answer was painful to deliver. It was the ibuprofen. That harmless over-the-counter pain reliever he'd been taking for his knees had systematically weakened his heart over 2 years. George's story isn't unique. It's a pattern I see again and again, and the tragedy is that it's preventable. So let's talk about the main culprit. The class of medications I'm most concerned about for aging hearts is NSAIDs, non-steroidal anti-inflammatory drugs. These include ibuprofen, naproxen, diclofenac, and even aspirin in high doses when used chronically. Now, I know what you're thinking. These are sold over the counter. They're in every medicine cabinet. Millions of people take them. How can they be dangerous? Here's the brutal truth. NSAIDs are very effective at reducing pain and inflammation. No one disputes that. But they achieve this by blocking enzymes called COX-1 and COX-2. These enzymes don't just cause pain, they also regulate critical functions in your body. One of those functions is maintaining blood flow to your kidneys and keeping your blood vessels relaxed. When you block these enzymes chronically, several devastating things happen to your cardiovascular system. First, NSAIDs cause your body to retain salt and water. Your kidneys, which normally excrete excess fluid, start holding onto it. This increases the total volume of blood circulating in your system. Imagine your heart as a pump trying to move water through pipes. Now suddenly, there's 20% more water in those pipes. The pump has to work harder. For a young, strong heart, this might be manageable. But for a heart that's 65 or 70 years old, already dealing with some stiffness or mild weakness, this extra workload can be the breaking point. That's how heart failure begins. Second, NSAIDs raise your blood pressure. They do this by constricting your blood vessels and by making your kidneys less effective at eliminating sodium. Even if you're taking blood pressure medication, NSAIDs can blunt their effectiveness. You might think your pressure is controlled, but it's secretly creeping up. High blood pressure is one of the biggest risk factors for heart attacks, strokes, and heart failure. It's a silent assault. Third, and this is critical, NSAIDs increase your risk of having a heart attack or stroke. Major studies, including one from the FDA in 2015, confirmed that even short-term use of NSAIDs, as little as 1 week, can raise cardiovascular risk. For older adults with pre-existing heart disease or risk factors like diabetes, hypertension, or high cholesterol, the risk is even higher. We're talking about a 20 to 50% increased risk depending on the drug and the dose. Fourth, NSAIDs can cause something called atrial fibrillation, an irregular heartbeat that dramatically increases your risk of stroke. The electrical system of the heart, which is already more fragile in older age, can be destabilized by the inflammatory changes NSAIDs cause in the body. And here's the cruelest irony. Because NSAIDs are so effective at masking pain, people like George keep taking them without realizing the cumulative damage they're causing. There's no immediate symptom. Your heart doesn't hurt when it's being weakened. The damage is silent, progressive, and often only discovered when it's too late. But NSAIDs aren't the only problem medications. Let me talk about another common class, certain blood pressure medications, specifically older ones like some calcium channel blockers, when used inappropriately, and especially first-generation beta blockers in patients with certain types of heart failure. And there's a huge concern with proton pump inhibitors, or PPIs, like omeprazole. These are the drugs millions take for heartburn and acid reflux. They're often prescribed for years without reevaluation. Recent research has linked long-term PPI use to increased risk of heart attacks and chronic kidney disease. The mechanism isn't fully understood, but it may involve reduced nitric oxide production, a molecule that keeps blood vessels flexible and healthy. Now, I want to be absolutely clear. I am not telling you to stop taking your medications. That would be dangerous and irresponsible. Many of you need these drugs, and stopping them suddenly can cause serious harm. What I am telling you is that you need to become an informed and proactive partner in your own health care. And that starts with recognizing the warning signs that a medication might be harming your heart. Let me give you 5 critical warning signs. If you experience even one of these, you need to talk to your doctor immediately. Warning sign number 1, unexplained shortness of breath, especially when lying flat or with mild exertion like walking upstairs. This could indicate fluid building up in your lungs because your heart isn't pumping effectively. Warning sign number 2, swelling in your ankles, feet, or legs that doesn't go away overnight. This is a classic sign of fluid retention, which can indicate your heart or kidneys are struggling. Warning sign number 3, sudden weight gain, 2 to 3 pounds in a day or 5 pounds in a week. This isn't fat, it's fluid accumulation, and it's a red flag for heart failure. Warning sign number 4, persistent fatigue that's different from normal tiredness. We're talking about exhaustion that doesn't improve with rest, the feeling that even simple tasks are overwhelming. This happens because your heart isn't delivering enough oxygen-rich blood to your muscles and organs. Warning sign number 5, a new or worsening cough, especially one that produces pink or frothy sputum. This can indicate fluid in the lungs, a direct result of heart failure. George had all 5 of these signs, developed gradually over 6 months. But because they came on slowly, he and his wife chalked it up to getting older. That's the danger. We normalize symptoms that should be alarms. So what do? Here's your action plan, and it starts with a medication review. I want you to schedule an appointment with your doctor specifically to review every medication you're taking. Not a rushed 5-minute visit, a real conversation. Bring a list of everything: prescriptions, over-the-counter drugs, vitamins, supplements, herbal remedies, all of it. And I want you to ask these specific questions. Question 1. Doctor, given my age and my heart health, is this medication still the best option for me, or are there safer alternatives? Medicine evolves. What was prescribed 5 years ago might not be the best choice today. Question 2. What are the specific cardiovascular risks of this medication for someone my age? You deserve to know. Make your doctor explain it in plain language. Question 3. Can we try lowering the dose or using it only when absolutely necessary instead of daily? Sometimes less is more, especially with NSAIDs and PPIs. Question 4. Are there non-drug options we should try first? For pain, physical therapy, weight loss, topical creams, or even acupuncture might help. For heartburn, dietary changes and elevating the head of your bed can be remarkably effective. Question 5. How will we monitor for side effects, and how often should we reevaluate this medication? Nothing should be a forever prescription without regular check-in. Now, let's talk about safer alternatives, because I don't want to leave you feeling hopeless. For pain management, especially for arthritis, there are options that don't carry the same heart risk. Acetaminophen, also known as Tylenol, is generally safer for the heart when used at recommended doses. It doesn't have the anti-inflammatory effects of NSAIDs, but it does help with pain. Topical NSAIDs, creams or gels applied directly to the painful joint, can provide relief with minimal systemic absorption, meaning they don't circulate through your whole body and affect your heart and kidneys. Physical therapy and exercise are incredibly powerful and underutilized. Strengthening the muscles around an arthritic joint can reduce pain significantly. Weight loss, if needed, takes pressure off joints. I know it's not easy, but even losing 10 pounds can make a huge difference for knee or hip arthritis. For acid reflux, lifestyle changes are the first line. Eat smaller meals, avoid lying down for 3 hours after eating. Cut out trigger foods like caffeine, chocolate, spicy foods, and citrus. Elevate the head of your bed 6 inches. These simple changes can often eliminate the need for daily PPIs, but here's something most people don't know. If you do need to stay on an NSAID for chronic pain, there are ways to minimize heart risk. Take the lowest effective dose for the shortest time possible. Naproxen at low doses appears to have a slightly better cardiovascular profile than ibuprofen. Avoid taking NSAIDs if you've recently had a heart attack. The risk of a second event is significantly higher. And if you're on low-dose aspirin for heart protection, be aware that some NSAIDs, like ibuprofen, can actually interfere with aspirin's protective effect. Timing matters. Take the aspirin at least 2 hours before the ibuprofen. And here's another critical point. If you absolutely must take an NSAID chronically, your doctor should also prescribe a PPI to protect your stomach from ulcers and bleeding. But then you're on 2 medications, each with their own risks. It becomes a balancing act, and that's why the conversation with your doctor is so essential. Let me tell you what happened to George after his heart failure diagnosis. We stopped ibuprofen immediately. We started him on heart failure medications, diuretics to remove excess fluid, and drugs to help his heart pump more efficiently. We worked with a physical therapist to find non-drug ways to manage his knee pain, including exercises and a knee brace. We also discovered that losing 15 pounds took a huge amount of stress off his knees. Within 3 months, George's heart function improved significantly. His breathlessness resolved. The swelling went away. He got his life back. But here's what George told me that stuck with me. He said, "Doctor, I wish someone had warned me before I started taking that medication every day. I trusted it because it was so common. I never thought to question it. That's why I'm making this video. I want you to question it. I want you to be informed, because your heart, after working for you for 6 or 7 decades, deserves the most careful protection." Now, I want to address something important. Some of you watching this might be thinking, "But my doctor prescribed this." Are you saying my doctor is wrong? No, that's not what I'm saying. Your doctor prescribed what they thought was best at the time, based on the information they had. But medicine is complex. Doctors are human, and sometimes the risks of long-term medication use aren't fully appreciated until years later. That's not malpractice, that's the reality of medicine. What I'm advocating for is a partnership. You and your doctor working together, regularly reviewing and updating your treatment plan as new evidence emerges and as your body ages. And here's the thing about aging that many people don't understand. Your body doesn't process medications the same way at 70 as it did at 50. Your liver and kidneys, the organs responsible for breaking down and eliminating drugs, slow down. This means medications can build up to higher levels in your system. A dose that was safe at 50 might be too much at 70. That's why dose adjustments in medication reviews are so critical as you age. Let me also address a dangerous myth. Natural doesn't always mean safe. Some herbal supplements and over-the-counter products can also harm your heart, especially when combined with prescription medications. St. John's wort, for example, can interfere with blood thinners and heart medications. High doses of certain vitamins, like vitamin E, have been linked to increased heart failure risk in some studies. Always disclose everything you're taking to your doctor. Before I close, I want to give you hope. The heart is resilient. Even when it's been weakened, even when damage has been done, it can often recover if we remove the offending agent and support it properly. I've seen it happen hundreds of times. Patients who were on the brink of needing a heart transplant, who made medication changes, lifestyle adjustments, and worked closely with their care team, and who are now living full, active lives. Your heart has been your faithful companion, beating for you every second of every day of your life. It's carried you through joy, through stress, through loss, through love. It deserves your advocacy. It deserves your questions. It deserves your vigilance. So here's what I want you to do this week. Today, make a list of every medication and supplement you take. Tomorrow, call your doctor's office and schedule a medication review appointment. Tell them you want dedicated time to discuss each medication. And when you go to that appointment, bring this list of questions I gave you. Don't be intimidated. You have every right to understand what you're putting into your body and why. If this video has opened your eyes, if you think it could help someone you know, maybe a parent, a friend, or a spouse who takes multiple medications, please share it. One share could prevent a heart failure hospitalization. One conversation could save a life. Subscribe to this channel if you want more honest, evidence-based information about protecting your heart as you age. And leave a comment below. Tell me, did any of this surprise you? Are you taking any of these medications? What questions do you plan to ask your doctor? Your story might inspire someone else to take action. Always remember, you are not a passive recipient of medical care. You are an active participant. Your heart's health is too important to leave entirely in someone else's hands, even a doctor's. Be informed. Be curious. Be your own best advocate. I'm Dr. Michael Turner, and my mission is for you to live a long, vibrant, heart-healthy life. Take care of your heart, and it will take care of you. See you in the next video.